This is a gentleman who's had multiple injections of Lucentis at monthly intervals with very little response, and a lot of his leaks were away from the fovea, but he had some central edema, and we've been injecting him very, very frequently with very little response. So I did this to see if we could debulk some of the fluid, and by using the Navilas laser, I precisely put in the marks that I wanted and no extra marks, and didn't have any areas that I was concerned about. We were able to avoid the central area very easily. First, he's cooperative, but more importantly, the Navilas laser is so precise in putting marks in that you don't have to go over marks and you don't have to repeat it and get unnecessary energy in the area. So this was extremely helpful to treat this man. He probably will, unfortunately, may require some additional injections, but hopefully will need much, much less, because it's been monthly with very little response. This laser, I mean, as compared to conventional laser, is much more comfortable. I mean, you can do this laser without having a contact lens on the eye. Once you've established the overlays and you've mapped out your treatment plan, if the patient keeps their other eye open, you're able to treat without putting a lens on. A lot of our patients just can't tolerate monthly injections or every 5-week injections. So the ability to more or less cure the problem would be great. In the diabetic patients, it's such a precise amount of laser that's placed. Once we've dried the patient up, you may be able to reduce the anti-VEGF therapy. And that's a study that's ongoing with several other centers right now to see if that's possible. If with the use of a combination of anti-VEGF and very focused laser that's precisely planned out, that allows us to get as close as we want to the fovea, but won't over-treat, and we won't have variations that occur whenever you do a laser project. If you do any type of laser study, there's individual variations how people treat. This is much more standardized and allows a much more precise way of applying the treatment. If I had a patient that needed focal treatment for diabetic retinopathy, branch vein occlusion, I would definitely want to use that laser. It's much more precise than anything that we have currently. We have days when we have several doctors in the office, simultaneously, and though you can shoot the images directly on the Navilas laser and actually have them right there, you also can take them on all our other cameras that we have here. So there's no backlog and there's no waiting for that room to open up. So it's great. It allows us to have a better patient flow. It allows multiple doctors to use the laser, and it doesn't interrupt our clinic at all. If the laser does what we're hoping it will do, it will improve our compliance tremendously, because we're going to reduce the number of injections. Patients don't mind coming in every 2 months or every 2.5 months or even 3 months. But when you have to come monthly for a year and a half, 2 years, and you're holding a 2200, 2100, even 2080 vision, which is maybe good for that patient, and we're happy to hold it at that, they become disenchanted with continuing the treatment. So if we're able to take some of the branch vein occlusions and reduce the leakage precisely, perhaps there's a way that we can use combination therapy of anti-VEGF or steroids and lasers. So I think that this will hopefully improve outcomes. I mean, the bottom line is laser is fine, but it has to improve your outcomes, and either improve your outcomes by the safety, which means that this laser is safer than the regular laser. At least our experience has been that this is more precisely put. You can actually standardize your treatment very well. Patients, movement doesn't matter. It's so you're getting a very excellent treatment with much fewer marks than I would use normally. And then the safety of reduced injections and just the convenience factor for the patient is really, really important.